Hey, welcome. Today we're going to cut through all the noise. The fad diets, the quick fixes, all of it. We're going to demystify what a professional, safe, and really structured approach to weight management actually looks like. And we're going to do it by diving straight into an official clinical guideline.
So, that brings us to the big question, right? What does a plan like this really involve? Like if you walk into a clinic or a pharmacy for help, what should you actually expect? It's often way more comprehensive than most of us think.
And here's the key thing to get right from the start. This is a journey. It's a structured, collaborative process with clear steps and, really importantly, safety nets. It's not about just getting a single prescription or being handed a diet sheet. Okay, so let's explore this official roadmap.
So here's our game plan. First, we'll touch on why a guideline is so crucial in the first place. Then we'll walk through the whole journey, step by step. The first steps, the deep dive health assessment, how a plan is actually created for you, the critical moments when a doctor needs to get involved, and finally, what it takes to achieve long-term success.
So why even have a formal guideline? Well, it's because weight is an incredibly complex and sensitive issue. A structured approach like this makes sure that the care you get is consistent, it's safe, and most importantly, it's centered on you as a person and is completely non-judgmental.
What's so important here is that right away there's this acknowledgement that this isn't just about willpower. That's a huge shift in thinking. The guideline recognizes that your behavior, your genetics, your environment, they all play a part. And that's exactly why a team approach works so well. The goal is your long-term health, not just a number on a scale.
All right, let's get into the nitty-gritty. Before any advice is given, there are some professional boxes that have to be ticked. This is that initial screening and eligibility phase.
So, this flow chart you're looking at, it's basically the playbook. This is the exact roadmap we're going to follow. It's the step-by-step guide a healthcare professional, like a pharmacist, uses to make sure every single base is covered, starting right from the top.
And that very first box on the chart, it's a simple but absolutely crucial check. Are you over 18, and have you given your informed consent to start this process? This makes sure the service is a good fit and that you're a willing partner in this journey from day one.
Okay, so once that first box is ticked, we move into what is probably one of the most important phases, the health assessment. And this isn't just about weighing and measuring. No, this is about building a complete 360-degree view of your unique health situation.
If we look back at our roadmap, you can see we're now right here in this section, patient history and assessment. This is the deep dive. This is where the real information gathering begins.
And wow, this assessment is thorough. It covers your entire weight history, any medical conditions, medications, and of course, diet and activity levels. But it goes even deeper than that, looking at lifestyle factors like, do you have a support network? And it even includes screening for mental health. All of this is absolutely essential to create a plan that actually fits into your life. The assessment also includes some key health checks to screen for common related conditions. So a blood glucose test checks for diabetes risk, a lipid panel looks at cholesterol to check on your heart disease risk, and a simple blood pressure check can spot hypertension. It's all about getting that full picture of your health.
Okay, so you've gathered all this info. Now what? Well, now it's time to actually build the plan. This is where all that data from the assessment gets turned into a personalized strategy that works for you.
So the guideline lays out two main paths. Pretty much everyone starts with what's called Management Plan A. That's the foundation, lifestyle changes covering nutrition, physical activity, and behavior. And only if that approach isn't getting the results needed after about 3 months is Management Plan B considered. That's when more intensive strategies might come in, like medically supervised diets or even medication.
So what's the goal here? What's a realistic target? The guideline recommends aiming for a 5 to 10% loss of your starting body weight.
And why that specific number? Because the science on this is super clear. Even that modest amount of weight loss brings significant health benefits, especially for your heart. It just goes to show that small, sustainable changes can have a massive positive impact on your overall health.
Okay, this next part is absolutely crucial. A huge part of this professional approach is knowing the limits and keeping things safe. This is a team effort, which means it's vital to know when it's time to bring in a doctor or a specialist.
And you can literally see these safety nets built right into the flowchart. These different colored sections are clear triggers, specific situations where getting a doctor involved isn't just a good idea, it's required.
So there are some definite red flag situations where a direct referral to a doctor is needed right away. This includes things like pregnancy, having a body mass index over 40, a history of bariatric surgery, or if you're taking certain meds that are known to cause weight gain. These cases need a doctor's oversight from the get-go.
And then you have these other cases where treatment can start, but a doctor also has to be brought in to collaborate. This happens with patients who have diagnosed psychiatric conditions, for anyone over 65, or for people with other complex medical issues like cardiovascular disease. The goal is always integrated, safe care.
All right, so we're not done yet. The journey doesn't just stop once a plan is in place. Now the focus shifts to the long game, long-term success, and regular clinical review.
You see, lasting success is all about continuous support. The Guideline recommends regular check-ins, often about once a month. These meetings are for tracking progress, talking through any challenges or side effects, and just reinforcing those positive lifestyle changes. It's a process, not a one-and-done event.
You know, there's this one quote from the Guideline that I think just nails the whole spirit of this approach. It's all about positive reinforcement. It's about celebrating the progress you've made, focusing on your achievements, and creating a compassionate and motivational space for long-term health.
So, after walking through this whole professional roadmap, it kind of leaves you with a question, doesn't it? After seeing this level of structure, safety, and personalized care, what does a truly supportive health journey look like to you? Thanks for sticking with me on this one.